Good evening, people. We are in Pune today, and the reason we are in Pune is because we have to find out the solutions to the problems we had highlighted in our last episode, how five-star hotels make you poor and miserable. And although the doctors whom we have spoken to consider that we went over the board, but we stand by our story. But before we get further, we need to highlight some facts before you, ladies and gentlemen. Sample this. 90% of the medical graduates in the market today, which come out of the various colleges in the medical field, are hired by the private sector and are currently working for the private sector in this country. 95% of the postgraduate doctors coming out of medical colleges are right now working for the private sector again. 99% of the medicines which we see in the market are manufactured by private pharmaceutical companies. Last but not the least, 100% of the medical instruments available in the market are manufactured by private sector manufacturing players. Now, this is a big number, so it is but obvious for any individual to ask that if the private sector healthcare holds such a command and influence over the entire medical sector, where is the regulation and accountability? And to talk just that, we have with us Dr. Abhay Shukla and Dr. Arun Gadre from Sati. Doctors, thank you so much for being here. My first question to you will be, what is your assessment of the regulation in the private medical sector? What is the state of the regulation as of today?
You see, the private medical sector in India right now is some of the critical aspects of this sector are unregulated. And I would say some of the relatively peripheral aspects are regulated. But the core content of medical care, the quality of care, the costs of care, the rationality of care, and patients' rights, these are unregulated. So hospitals, in that sense, the core of their business is not regulated. And given the fact that it's such a huge sector, as you've pointed out, this is a giant with feet of clay because it's standing on very shaky grounds.
You have mentioned some very specific points in your book. So if you could just elaborate, and especially for the young viewers who are out there and they're seeking to learn from you, many of them could be aspiring doctors as well. So what, according to you, is the status of the regulation? You highlighted that in brief, but could you please elaborate a little bit?
In the mid-1980s, 60% of hospitalizations were in public hospitals and 40% only were in private hospitals. So the big hospitals in any city used to be either a public hospital or a charitable hospital. This is something which people in our, in this generation may not be aware of. This changed within 20 years, and in 2004-05, when the next round of data came in, the ratios had reversed. So it was 60% in the private sector and 40% in the public sector. So in 20 years, between the mid-80s to the early 2000s, mid-2000s, the proportion shifted towards the private sector. Because the public health system remained weak, it was not adequately resourced, and the private sector grew exponentially and very rapidly. So when this sector was growing, actually it should also have been regulated. Maybe it was not regulated in the 1970s, one can understand it. But in the early 2000s, by that time it was very clear that it's taken over the public health system. The regulation actually lagged behind completely and is still lagging behind. It has not kept pace with the growth of the sector, with the growth of patients going to this sector, and that is why we are seeing this crisis, which we've pointed out in our book, that people are going to these big hospitals, big private hospitals, they are paying a lot of money, they are expecting quality care, but actually what they are getting is often a question mark. It's very variable because there's no standardization and there's not adequate regulation.
So what, according to you, should be done to effectively regulate the condition of the private sector healthcare in India as of now? What steps should be taken by the government and by, of course, the civilian population?
I would say three things at least need to be done immediately or urgently. Firstly, all private hospitals must be effectively regulated for the quality of care, for the rationality of care, for patients' rights, and moving towards standardization of rates. And all this is possible through appropriate clinical establishment acts. There is already such an act at the national level, which was passed in 2010. The rules were passed in 2012. But till now, this act, the central act, Clinical Establishment Act, is actually not operational in any state of the country because it has been blocked, it has been resisted by a section of the private medical profession, and therefore its implementation has been delayed tremendously. So as citizens, we should all demand that these acts should be implemented, but with accountability and with participation. We don't just want a bureaucratic regulation where some inspector or some babu comes in and just goes to the hospital, takes a bribe and comes back. We don't want that kind of regulation. We are actually interested in a situation where, if there is a regulatory body, there is an inspector or whatever authority, they are also held accountable by a multi-stakeholder council. And there are such systems in other countries in the world. And that multi-stakeholder council at the district level, at the city level, would have doctors' representatives, it would have civil society groups, it would have consumer representatives and also officials, so that if the regulators are going off track and instead of actually ensuring patient interest, they are doing something else, they will be brought onto track. Like Brazil has a system of health councils where this kind of multi-stakeholder regulation has been operationalized. So that is the kind of regulation that we need in this country through clinical establishment acts with accountability, with patients' rights and with multi-stakeholder bodies.
I'm glad you brought Brazil into this picture, because Brazil is far more corrupt than India is as of now, if you compare the political situations. You mention a very interesting part in your book. It's called lack of political will. What is this lack of political will and how is it impacting the healthcare sector?
You see, in our country there's a peculiar situation. Those public services which are used by everybody, including the middle class, they are relatively well maintained. And those public services which are only used by the poor, they tend to be underfunded and they tend to actually suffer from neglect, political neglect. So the point is that political will comes when large sections of the citizenry and including the middle class raise a voice about something. So perhaps for various reasons until now the middle class has remained not very vocal on the issue of regulation of the private sector. But it is our firm belief that now things have reached a stage where even middle class people should start speaking up. And they should start raising these issues. And they are actually also suffering the brunt of irrational care, expensive, unaffordable care, and often even violation of patients' rights. So now the stage is being set where political will can be generated if there is a voice from different sections of society.
That is a very interesting point which you raised, Doctor. But very important part of public outrage or middle class outrage is awareness. Unless they don't know what they have to protest against or what they have to protest about, protests are generally considered at a back foot. What are patients' laws? Because most of the people don't even know what patients' rights are. Laws, my mistake. By mistake I said laws. Patients' rights. What are patients' rights?
First right is right to emergency medical care. The Supreme Court and even the National Consumer Redressal Forum have clearly stated and ruled that if a patient in an emergency is taken to a hospital, public or private, they first of all should be treated with irrespective of their economic status, irrespective of their capacity to pay, at least stabilization.
That's a patient's right.
Yeah, that's a patient's right. It's a legal right. And people have approached the court and they have gotten relief from the Supreme Court on this issue. But today 99% of hospitals are not following this. They say first you put the deposit, first you give us the money and then we will start the treatment. It should be the other way around. In an emergency, the patient's life is critical, it is of utmost importance, and first treatment should be initiated, and then after giving initial treatment, of course, whatever payment formalities can be introduced, and at the most, if the patient is not able to pay, then they should be properly shifted after stabilization to some other appropriate hospital. The second is right to information, records and reports. Right to information is not only about public officials. Even in private hospitals, if I am a patient and I go to a hospital, I should know what is my diagnosis, what is the broad line of treatment, what is the broad expected cost of treatment, and whether there are any risks or any options that are involved in the treatment. This is the bare minimum. And also if I get an
alternative treatments also,
and also, and any alternatives, options.
Yeah.
And secondly, if I have got an investigation, I got an ultrasound, I got an MRI done, I got a blood test, I am admitted in the hospital, and suppose I want to show it to my friend who is a cousin who is a doctor, or I want to take a second opinion, all those records and reports, I should get them as a right. They have been done on my body.
I will give you a real life example. One of my Marathi publisher, he went to one gynecologist and she did somewhat supposedly sonography and suggested some plan of action. He said, I want to have second opinion, I will go to another doctor. The sonography report and plate was not given to him. This is happening this year in Pune. So this is happening, and that I told him on the phone that it is your right. He said, forget about right now, I will go to another person, do the sonography again. But he had to do sonography again. And we don't know what exactly that sonography report on which the advice was given was actually a correct one or wrong.
It's not necessarily that I mistrust the doctor, but something very major is being recommended, maybe an operation or a major procedure, or there is some doubt about the diagnosis, it's not very clear, it's a grey area. In that case, I have a right to approach a second doctor, and the first doctor should not object to it. The first doctor should make available the requisite information. At the same time, the second doctor should also communicate with the first doctor, and it should not be a case of patient snatching. That is also a converse part of it, because unfortunately even that is happening today, because of which some doctors have become a little wary of second opinion. But nevertheless, second opinion is also an important right. A third very important right is the right to choose the pharmacy from which you want to buy the medicine.
Oh, that is a right?
Yes.
Right? It is a right.
You can
Mostly,
choose
Nobody can
which
com-
company you want
nobody
to buy.
can-
Nobody can
force
compel you to buy the drug from the same pharmacy
Same.
of the same hospital.
In our country, it is said the consumer is king. In this respect, the consumer becomes a slave.
Because he's forced to buy medicines from the company.
But it's
prescribed by
the National
doctors.
Consumer Redressal Forum has clearly ruled that the patient has a right to choose the pharmacy and the laboratory of their choice. You cannot be forced to buy medicines only from the hospital, medical store or pharmacy.
That's a very interesting point which you brought, doctor, and that brings me to the question of pharmaceutical companies. How they have controlled the entire private sector now. Because I read in your book, there have been stories of pharmaceutical companies sending doctors abroad, loading them with perks, doing many things for them, and in return asking them to recommend their medicines.
Two things I will quote from the book only. Dr. Sanjeev Mukhopadhyay, he is the gynecologist, he has agreed to reveal his name. He has told me that he addressed one conference of some organization of the medical faculty, and he asked people that at least those who have come on the sponsorship of the pharmaceutical should wear the tie of that pharmaceutical company.
That was...
He made an appeal so that at least we will be able to find out who is coming on his own. What is wrong? Why you are shy about it? If you have taken money, why not? That is one. Second thing, one big town, one pediatrician told me that till 10 years back, that particular town doctors were having their continuous medical education sessions from their own contribution. And naturally, then they will choose the subject which is dear to them, which they want to discuss. But gradually, the doctors, by democratic process, overruled this person who was insisting that we will continue to do similarly by our own contribution, and that association of that town passed a law or a rule that hereafter only pharmaceutical companies will sponsor our conferences and continuous medical education.
So now pharmaceutical companies have practically taken over all the conferences organized in cities.
Yes.
Then they decide the topic.
They decide the topic.
the content. So, I mean, if it's like saying that, you want to go to a restaurant, but the restaurant owner will decide what you will eat.
So, doctor, what is the solution in this regard? Because pharmaceutical companies have been known to be giant behemoths who are eating up into customers' pocket in health.
Yeah.
The irony is that they should be doing the opposite. So, what is your assessment and how should this be regulated?
In the short term, two things need to be done. Firstly, standard treatment protocols as part of the Clinical Establishment Act. In the sense that if a patient has a common cold, this protocol should be clear. No medicines required except paracetamol. Now there are half a dozen or probably many dozens of so-called cold remedies in the market which are irrational. But the doctor should basically stop prescribing them because they are not part of the standard protocol.
My cousin was telling me that in US, he got a most cultural shock. He went for the cold of his child and doctor said, no prescription, you go do whatever hot water and like that. And he was so upset that doctor had not given a single tablet. So that is how he got this cultural shock in US. Where means why can't that protocol come here?
First of all, irrational prescriptions and accompanied by prescription audit, obviously, and that's part of the game. So there are standard treatment protocols. Each doctor knows that, they are oriented about it, and then they are supposed to prescribe or supposed to write medicines according to those guidelines. And maybe once in a while they may deviate, but then they should give a reason for that. So if those standard treatment guidelines are in place, irrational prescribing will reduce. But basically, there are Me Too drugs. There's an established quite effective drug which is available, which is cheap because it's now out of patent. And then the pharma company comes in with a drug which is 10 times more expensive, which is almost the same. Maybe it offers some marginal benefit, like instead of 2 times a day, you can take it 1 time. That's all. That Me Too drug is then pushed to doctors, and then doctors start prescribing the expensive drug instead of the tried and tested and reasonably effective existing.
Can consumers consumers have a legitimate way of fighting this?
See, consumers can do one thing, and that is to learn the difference between the branded drug and the generic medicine. And you know the difference probably, and I suppose most viewers will be knowing that the same medicine, let us say paracetamol, is sold by 100 different countries and companies under 100 different names. So Crocin, Metacin, Calpol, these are all brand names. The core generic drug is paracetamol. Now in the market, what is happening is that if paracetamol is say 1 rupee a tablet, various companies are selling it for various prices. The option that can be there is that if generic medicine stores are available, and consumers also know that I don't have to go for the most expensive brand, I can even buy a cheaper standard brand, and there are certain websites which give you the equivalents, you can buy the cheaper but good quality generic medicine and escape from paying very high prices for medicines unnecessarily.
Okay.
So this should be implemented. If this is implemented from tomorrow. Medicine, the overspending on medicines will reduce drastically. It's one simple measure. While writing the prescription, along with the brand name, the doctor should write the generic name.
But one interesting part of the book which I really liked was that, like other doctors who keep lamenting about the situation and who keep ranting about the situation, you people have taken the story to a different level and also seen it from the other side, which brings me to people's perception. What will be your advice to people, and especially youngsters, who believe that expensive treatment is always better, which we have also showcased in our episode? You need to catch on that perception. What should be done to change this, and what is your advice to youngsters and of course people who spend a lot and think expensive treatment is better? What is your advice to such people?
Number one, healthcare should not be a commodity, and it should not be looked upon like a commodity. When you're buying a pair of shoes or a pair of jeans, you will probably say, okay, the more expensive one is likely to be better. May or may not be, but okay, maybe let us assume. They should be aware that a procedure or an operation which is prescribed, if it is something which is quite major, just because it is expensive or it is being prescribed by a big hospital, that is not sufficient basis, to automatically accept it. If they have some doubt, they should seek second opinion. And they should, over a period of time in every city, people should develop this kind of a network of some, contacts of rational doctors who can give good quality second opinions. So people should go for second opinions, especially when there are major procedures which are being recommended.
I will add one thing, and people should also be ready to accept rational advice. Just because a small hospital has advised you to go for angioplasty, and a small person like me sitting in a very low ambient setup is sincerely telling you not to go, please believe in us. That is what we are saying, number one. And number two, some system has to be developed for people to approach the second opinion. So we are in Pune in the process of developing a Pune doctor-patient forum. We are in process. I don't know how far we will succeed, but doctors have joined us, citizens have joined us, and I hope that we will succeed.
And there is entire chapter in our book, which says how to choose a rational, ethical doctor. And that is exactly about this. How can you make out as an ordinary person, as a lay person, whether the doctor I am dealing with is rational, ethical or not? First of all, a good doctor, a rational doctor, doesn't mind being asked questions and always gives the patient options wherever available. That you can either do A or B, because he or she is not pushing the patient into only one line of treatment. When a doctor is pushing you into only one line of treatment, and usually which is more expensive and involves more intervention, becomes suspicious. Rational doctor will not usually, it depends on the case, but will not be super confident about the diagnosis from day one. If I am a good doctor, I will always have an element of doubt in my mind, especially in a complicated case, in a case where there is, multiple things are going on. I would talk in terms of probabilities and possibilities rather than saying, oh, this is X, just go for Y. So usually a doctor works their way through the case. you know. And this is a sign of being a good doctor.
Anyways, Dr. Abhay Shukla and Dr. Arun Gadre, thank you for speaking to Street Journos. It was a pleasure talking. Thank you, Doctor. So this is all what we have from this episode of Street Journos. We hope we were able to change the way you see healthcare in India today. Keep tuned for the next episodes, and until then, let's keep learning.